Welcome, everyone, and thank you for being here with us today for the informational webinar about the Mosaic Family Resilience Grant Program. My name is Kristen Paquette, CEO of C4 Innovations. C4 has the privilege of being a partner to RIZE Massachusetts on the Mosaic Opioid Recovery Partnership, and our team is supporting technical assistance for applicants and Mosaic grantees. Welcome again to everyone. Next slide, please. Today, our team will review key information about this grant-making round, which just launched last week. During our time together, the Mosaic team will provide an overview of the grants, who should apply, how funds can be used, how to apply, how the awarded grant projects will be evaluated, and the types of support available to grantees. We'll then leave a few minutes at the end of the hour to answer questions from participants. A couple of quick housekeeping notes before we begin. As a reminder, all participants will remain off camera and muted throughout today's webinar. Please feel free to share comments in the chat throughout the webinar. However, if you'd like to submit a question for us to answer during the Q&A portion at the end, please submit it in the Q&A area. We will cover as many submitted questions as we can at the end of the webinar. We'll also post the questions and answers on the Mosaic website soon, including any that we were unable to answer during today's webinar. Next slide, please. To lead us off with a reflection and sharing of the Mosaic Memory Wall and a bit of information about the Mosaic Grant-Making Initiative overall, please welcome Julie Burns, President and CEO of RIZE Massachusetts. Julie?
Thank you, Kristen. It's a pleasure to be with everyone here this afternoon. It looks like we have quite a few attendees in the webinar, so thank you so much for giving us your time and attention today as we talk about the next Mosaic grant. And as we do at the beginning of all Mosaic programming, we like to take a moment to reflect on the settlement funds, the settlement funds that make Mosaic possible, and give honor to those who have lost their lives to overdose. At RIZE and with Mosaic, we have grounded the program in hope and opportunity, and the recognition that this money is very serious and represents the loss of life and devastation from our communities. Early on in Mosaic, last year, we created a memory wall, which can be found on the Mosaic website, where you can post a photo and a statement about a loved one if you have lost them. I also would like to just take a very brief moment to ask people if they're so interested to put names of those they've lost in the chat, and just take a very brief moment of silence. So thank you for that, for allowing us to do that. We appreciate it, and we want to make sure that those stories and memories, and I see some names coming in the chat, guide our work. Next slide, please. So I'm going to tell you a little bit about Mosaic, the big picture, and then I'm going to turn it over to my colleague, Jen Tracy, who will tell us more about the specifics of this grant program. But Mosaic Opioid Recovery Partnership was created by RIZE Massachusetts and the Department of Public Health, Bureau of Substance Addiction Services, to make sure that small community-based organizations had a pathway to apply for funds from the opioid settlement. As you can imagine, these funds are in great demand, and RIZE's role is to make sure that we get them to community-based organizations that are underserved and have experienced a disproportionately high rate of overdose deaths. All of our programming thus far, and will continue into the future, has been designed in partnership with the community and co-created by people with lived and living experience. We are talking today about our third grant program, but before we do that, I just want to give you a little bit of a reminder about the first two programs. Round one, which was the community based opioid response efforts grant, we awarded $3.75 million to 18 organizations back in August. The second round of grant making was a matching program with municipalities, doubling the impact of their dollars. We awarded 1.5 in March. And then the program that we're talking about today, the Family Resilience Program, has a dollar value of 7.5 million, and these grants will be awarded in September. Next slide, please. And as I was saying, we do have some guiding principles that influence all of our work, and that's to center the voice of people, center the voices of people with lived and living experience. We have people guide us in our program design. We also have used community reviewers on all of the grant programs, and many of the folks that have been reviewers for the grants and help us determine where the funding goes do have lived experience, and I think many of them are joining us on the call today. We also want to make sure that all of our efforts are informed by equity, inclusion, and compassion. We work to reduce stigma in all of its forms, any chance we get. So that's a key driver of our work with Mosaic. And then we want to advocate for approaches that support all pathways to treatment, and allowing people to achieve their own goals regarding harm reduction, treatment, and recovery. Next slide, please. And now I'm going to turn it over to my colleague, Jen Tracy, our Chief Program Officer at RIZE, to discuss the details of the Family Resilience Grant Program. Thank you.
Great. Thank you, Julie. Hi, everyone. Thanks for joining us today. We're excited to share this grant program with you all. The Family Resilience Grant Program will provide funding for comprehensive support services to enhance family stability, improve child well-being, and strengthen community resources. The project should embed a family-centered approach, emphasizing the collective well-being of the family rather than focusing solely on the individual. And we're trying to think about family and what family means. So we want to make sure that people understand that projects can include support for grandparents raising grandchildren, parents with lived and living experience, other caregivers impacted by substance use, and or direct support for children. And for the purposes of this grant, we have defined family as a structure that includes traditional nuclear families, extended families, like I mentioned, such as grandparents, aunts and uncles, chosen families, and guardians or caregivers who play a significant role in a child's life. The key focus is on those who provide emotional, physical, and social support, regardless of legal guardianship or formal custody arrangements. Excellent, thank you. So the objectives for the Family Grant Program is to empower families through education, through trauma-informed care, and navigation of complex social systems, to improve housing stability for families and youth, to build healthy communities, enhance developmental, educational, and emotional support systems for children and their families, and promote the well-being of families by providing peer support, harm reduction education, and leading to a healthy environment for reunification and healing for families. Next slide, please. So as Julie mentioned, this is a 3-year grant opportunity. As you probably saw in the guidelines, the maximum request is $500,000 annually, and you'll hear throughout the webinar today a focus on the budget. Specific attention will be paid to the applicant's requested budget amount to ensure alignment with the organization's size and scope. Therefore, we anticipate the funding will support approximately up to 5 to 10 organizations. So who should apply? Thank you. Next slide. So as always, RIZE seeks to fund nonprofit organizations that work across the care continuum and serve diverse communities and populations, as Julie mentioned, that are historically underserved and have experienced a higher rate of opioid-related overdose deaths. And again, for this grant program, we're looking for organizations that have a total annual operating budget of $20 million or less. And these organizations should be 501c3s. Fiscal sponsorship is acceptable, and we are happy to answer questions on that. Agencies that provide multi-services to families, minority-led, minority-serving community-based organizations, tribal entities or community-led initiatives, Massachusetts serving organizations, and those that are in good standing with current state and federal reporting requirements. Next slide, please. Okay, so provide a little bit more detail. I think if folks have been following Mosaic and everyone knows that, as we've mentioned, these are settlement dollars from the state's ORF funding trust fund. So all projects and initiatives must adhere to the Massachusetts State Subdivision Agreement for statewide opioid settlements. That link is on the website, as well as the guidelines. If you have any questions about that. The funds can support and should support projects and initiatives developed with input from people with lived and living experience, public health experts, municipal leaders, and families, of course, affected by the opioid crisis. And we also recognize that families may have urgent needs that require attention. So wanted to be sure to point out that these funds can also be utilized for incentives or assistance with basic needs, such as transportation, emergency housing support, and childcare. Next slide, please. And so for the funding priorities, we have sort of created 4 broad categories that are highlighting some of the opportunities for this grant program. There's more detail within the guidelines of examples that fall within these buckets, but certainly they are examples and they're not intended to be exhaustive. So please, if you have questions, do ask. But the broad buckets are comprehensive family supports, and this is support for parents and caregivers. This could be support after the loss of a loved one, trauma-informed counseling, or non-traditional, art therapy, play therapy for children. And of course, you'll hear throughout just support, helping families navigate systems and services. Housing and stability support. This is emergency housing for families in crisis. This could also be funds used to develop recovery housing for families, connecting to transitional and supportive housing as part of aftercare. Early childhood and educational support is some examples to promote early childhood interventions, maybe pregnant, postpartum, support for women, and again, sort of foster and kinship care, family support, like grandparents raising grandchildren. In addition, the 4th category, community-based harm reduction and recovery support. Again, this is intended to look at maybe psychoeducational groups for communities, psychoeducational groups for families, peer recovery support, peer support in general, helping families navigate systems, and also support with harm reduction and overdose prevention for families. But again, just I send everyone back to the guidelines for even more examples. Okay, so we know that this is for organizations with a budget of 20 million or less. We have stated that. We wanted to just emphasize that the budget cap is a strategic choice of this grant initiative to really give small community-based organizations the opportunity to be creative, to be innovative, and also really to allow smaller organizations the ability to compete for these settlement dollars. Next slide, please. And funds may not be used for, this is standard RIZE standards for funding, care, or costs reimbursed by the state because of the settlement requirements. And this includes Mass Health as well as DPH BSAS, and this is to address supplanting. So there is no supplanting with these funds, although the funds may be used to strengthen and supplement services. Funds may not be used for fundraising, endowments, clinical drug trials, direct payments to individuals, or lobbying and legislative activity. Next slide. Okay, application requirements. We'll just talk about a few key dates, and then I'm going to hand it over to my colleague, Anne Marie Pagliano, who will walk us through the actual grant application. But important dates, as you know, the application was released last Tuesday. We are here at the webinar, April 28th. We will have another opportunity for folks to ask questions during office hours in May. So after you've had a chance to look at the application and really think about services to apply, and then application is due June 17th by midnight. Notifications, we intend to go out in September, and we are hopeful for a grant period to begin November 1st. And now I'm going to pass it to you, Anne Marie. So thanks so much to walk us through the application and the budgeting process.
Thanks, Jen. Hi, everybody. Anne Marie Pagliano here at RIZE. Yes, so I'm going to talk about some nuts and bolts right now about how we have set up the application process and what is expected during that process. So first of all, just so you know, our application process is completely online. Okay, so to access the application, you just click on a link and it will take you right to it. You can access that link at our website, mosaic.rizema.org, through the grant guidelines. Both places have live links, and it will take you directly to the application. The application itself is composed of some questions, and then we'll ask you to upload a couple of documents. The questions that are included in the application that you'll find online, you can see them ahead of time, and they're included in the guidelines, the grant guidelines, as well as posted on the website. So we encourage you to take a look at those before you start your application to give you time to kind of pull everything together. As Jen mentioned, the application is due on June 17th. That is a Tuesday at 11:59 p.m. But between now and then, or even after then, please, if you take nothing away from today, please remember this email address, grants@rizema.org, and you can email us anytime with any question. As was mentioned earlier, there will be an FAQ document posted on our website. We will put all of the questions we receive and the answers to them in that document, so you can refer to it anytime, but we will also respond to you directly if you email us with a question. So don't hesitate at all, any question at all, anytime at all. I just draw your attention to the right side of the screen. That is the very first page of our application. And we just wanted to show you what it looked like, because from there you can ask a question at GrantsAt, you can access the guidelines again, you can access the budget template, which I'll talk about in a minute. And it also shows you that you can save and continue later. So if you're starting your application and you need to stop for any reason and come back to it, you can do that. The other thing I'll mention is that the way you know that that you've been able to submit successfully is when you click submit at the end of the application, you will receive a copy of your application. It's for your files, but also so you know that the submit was successful. The two documents that we ask you to upload in addition to completing the application questions are a budget and an audited financial report. So next slide, please. This is what our budget template looks like. So what we ask you to do is we've created this template. You see it on the right side of your screen. We ask you to download this template and complete it in support of your application, and then upload it at the end of the application. The last page of the application document online will allow you to upload it. As you'll see, I should tell you the link for this budget template, you can find it through the grant guidelines. You can find it online at our website, and you can also find it, like we saw on the previous slide, on that first page of the application itself. So you'll be able to link to it, download it. We ask you to complete it. What you can see here is that we ask you to spread the budget over your 3 years. We also ask you to complete the narrative, which is on the right side, that right column. For every line item that you put in, we ask that you put a note there to let us know how that connects to your project. We also ask this just as a check that on the top part there where it says grant amount requested, it's very small, hard to see. But when you put in the amount that you're requesting, we ask that at the bottom of your at the template that it matches. So your budget matches the amount you requested. It's a small thing, but it makes a difference in the end. Once this is completed, save it and upload it to the application. The second thing we ask you to upload, next slide, please, is your audited financial statement. And that most organizations over a certain size will have this on hand, and we just ask you to upload it. If you do not have an audited financial statement for any reason, you can submit one of the other documents that's listed here under these bullets. So it can be unaudited, it can be a profit and loss, statement of financial position, organizational budget even, for the most recent complete year that you have. Any questions about this? If you don't have an audited financial statement, just email us and we can work it out. Okay, but this will be, the request is to upload this as part of your application on the last page. Okay, so that's what we require for the application and how it should work for you. I'm just going to give a few minutes to how we review the applications. Okay, next slide, please. What is most important to us at RIZE and through Mosaic is that the community impacted is involved in every step of these processes. So when we make our decisions about grant proposals, we do that through a community review process. So we recruit a pool of community reviewers that have lived and living experience or expertise in this area or have worked in overlapping areas. We recruit them specifically for expertise in order to give these proposals the best review possible. We train them, and then we ask all of the reviewers to read the proposals and then to score them against a common set of questions. That gives us a numerical score that allows us to rank the proposals then and make some decisions from there. The other thing I want to mention, though, is in addition to the reviewers' individual expertise, we ask them to consider these criteria that you'll see here on the screen. And those are really so that we can make sure that the grants are going to, that are serving populations and communities with the highest rates of overdose and death, communities that have been historically underserved, that the projects have been informed by people with lived and living experience, and they're rooted in health equity. Those are important to RIZE and to the Mosaic program. So we ask our reviewers to also look at the proposals from those perspectives as well. Once we have the scores from the community review process, this grant round, we're going to have one more level of review. Next slide, please. And you've heard about it a little bit already. We are going to do a budget review in this grant round, and the budget review will be done by RIZE staff. What we'll do is we'll take the top scoring from community review. So community review will lead this process, but the top scorers in that process will then have a budget review. And really what this is about is what Jen mentioned, what Julie has alluded to, is that we want to make sure that the size and scale of the proposed budget and project match the fit, the size, the scale, the capacity of the organization proposing it. So what that looks like is if we have a $19 million budgeted organization requesting $25,000 for a project, it just makes us want to look more closely to make sure that that project is going to have the impact that we're hoping for in this grant program. The reverse can also be true. A $1 million budgeted organization requesting $500,000 a year, we want to make sure that that capacity of the organization would be able to fulfill the goals of that project. We'll look at budget line items. We will look at that audited financial statement to make sure that since this is a 3-year program, that there is capacity and health in the organization financially. What this might lead to, I thought Julie was, what this might lead to, and maybe Julie, were you going to say something about this, is when we,
No, sorry, I didn't know you're doing a great job. But I just do want to iterate what Anne-Marie is saying. This is to ensure that the eventual grantees are successful in the implementation of these grants. This is not meant to be a punitive review or us taking too close a look at how you do your internal work. That's not what this is about. We just, as Anne-Marie very clearly said, and she's spot on, we want to make sure that the organization has the capacity to spend these funds within the time frame that they're awarded. There's no opportunity to carry over funds. with these grants, so you have to make sure that you've got the capacity to spend year one in year one, or we can't fund you for year two. And that's in part because of the arrangement that we have with the Commonwealth. We only get the money. We have to lay it out and then we get reimbursed for it. So there's a lot here. It's logistics, it's capacity, and it's our hope that the grantees will ultimately be successful, which is why we're spending so much time on this part of the presentation. So Anne-Marie, you were doing great. So thank you.
Oh, thanks. No worries. And what that might mean is if we, in our review, see that perhaps we have a question around capacity or ability to spend, like Julie just laid out, we may come back to you and we may look at the amount and just make sure it may have to adjust slightly. We want to be upfront about that. Those are conversations we may have as going through the process. That the requested amount may not be the exact amount of the grant at the end. There may be some back and forth to try to make sure that we can hit all of these parameters and give the project, from our perspective, the best chance of success and financial support. That is it for me. I'm going to pass it over now to Ranjani Paradise, who is with Institute of Community Health, to talk about evaluation. Thanks.
Thanks, Anne-Marie. So as Anne-Marie just said, I'm Ranjani Paradise. I'm with ICH, and we are the evaluation partner for the Mosaic program. So just to kind of set the stage for evaluation, I'm just going to really quickly review the reporting and evaluation components of the grant in the next couple minutes. For this program, evaluation is a really important component. The funding is really trying to fill gaps, address unmet needs. And so we really want to make sure that we learn from the approaches that the grantees take in order to be able to inform the broader field through the work. So it's really important that we can document who's reached, what kinds of services are delivered, and also that we understand how effective different approaches are for promoting family stability and resilience and well-being. So the overall hope is that the evaluation will be able to help grantees with their own program improvement, but also that organizations in Massachusetts and across the country can learn from the models that come out of this grant. So as the evaluation partner, ICH will be working with grantees to help develop the kinds of measures that we will be looking at, as well as data systems to collect and enter that data. So just to sort of set some expectations on the program implementation side, we're expecting that grantees will need to be tracking who they serve with some demographic information, and that grantees will need to track the types and amounts of services that get delivered through the grant. Then we will also be working with grantees to develop and administer an outcomes evaluation assessment tool that can measure how family stability, resilience, and well-being changes over time as families participate in the grant programs. And that tool is still to be determined. It'll be developed and finalized with input from the funded grantees. And then finally, our team will be doing some qualitative data collection so that we can have some more in-depth, nuanced information and stories that can complement the quantitative measures. So those are the core evaluation kind of data, documentation and entry expectations for the grant. In addition to that, part of our role is also to help RIZE and the Mosaic team understand how well they're doing and how they can improve just in terms of running the grant program itself. So that means we'll also ask grantees for some feedback about their experience with different elements of the grant. So those will just be really quick feedback surveys, opportunities to share how things are going. Next slide, please. So we know that organizations come with different levels of experience and capacity when it comes to data tracking. So part of our role as the evaluation partner is to provide support to help grantees to be able to participate in the evaluation. So you won't be on your own. We will be working with you to make this work within your organizational systems and processes. That being said, we know that evaluation and reporting takes time for the staff who are doing the work. So we just want to recommend when you are developing your budget and thinking about the amount of staff time that is going to be funded under the grant, we would strongly suggest that you incorporate some time specifically for data entry and reporting into the project budget. So that means for frontline staff who will be working directly with families, as well as any staff who are going to be responsible for the overall grant management. We would suggest just thinking about including some time under the grant funds for them to be doing the necessary documentation and data entry. And then just the last couple points here, there are going to be some networking and group learning opportunities throughout the grant period. And that's really intended for grantees to have an opportunity to share what they're learning, troubleshoot challenges with each other, and also have a chance to kind of elevate successes and kind of promising practices with the rest of the group. And then finally, in addition to the data tracking and assessments that I had mentioned on the last slide, those would be collected on an ongoing basis as each organization is working with the families that they serve. Grantees will also be asked to submit an annual progress report. So that would be a brief report, a narrative, kind of open-ended set of questions, which is a space to reflect on, share progress, successes, and challenges once per year. So that's it for the evaluation. I'm going to pass it on now to Elizabeth to talk about technical assistance.
Thanks, Rajani. Hi all, my name is Elizabeth Black, and I am with Kristen at C4 Innovations. And so I'm going to take just a minute to tell you a little bit about our role. We have partnered with C4 to provide technical assistance to all grantees for the life of their grant at no cost to them. If you're not familiar with technical assistance, it's just a really big word for help and support. So when grantees have a need of any kind, they reach out to us, and then we find somebody with expertise on our team, either in-house or contracted, to support them in whatever that need is. As an organization, C4 provides training and technical assistance both locally and nationally to support best practices and creating equitable services for marginalized populations. And what that means is a big chunk of our work is dedicated to folks that have substance use disorders. So we're really just honored to be a part of the Mosaic team on this. And technical assistance will be delivered in a variety of different ways. That could be one-on-one consultations with one of our subject matter experts, small group facilitation. If multiple grantees are coming forward with the same needs, then we'll pull them together to meet with the subject matter expert, which works really well because they can also share resources back and forth with each other, do brainstorming together, that kind of thing. May also take the form of action planning, targeted trainings to support information and skill building. And we provide technical assistance on a wide variety of topics, from building program infrastructure to grantees that are maybe younger, that are just starting to get kicked off, to like best practices and service delivery. The list of topics that we support folks on is not exhaustive. We basically tell you all, if you can dream it, we can do it. By doing so, we help to really promote long-term grantee success, not only within the grant, but also beyond, as folks are building their capacities. And then with that, I will turn it back to Kristen where we started, with reminders and Q&A.
Great. Thank you, Elizabeth. Sure, I'll just jump in and do some quick reminders, and then Kristen will, that's okay. And then Kristen will open up the Q&A. So appreciate the questions coming in. So as Anne Marie spoke about, sorry about that, grants@rizemass.org is where you'll send your questions, and we'll be responding to those as quickly as possible. The answers will be posted on the Mosaic website. We also have on the Mosaic website a resource list with a lot of helpful grant writing tools and supports for you as well. If people want to take a look at that, we've been accumulating those throughout the grant period of Mosaic. So please check that out. And as we said, office hours, May 19th, that's your next in-person time with us, 10 a.m. And you will find the registration link on the Mosaic website. So there will be a Mosaic family grant section on Mosaic website. I'll hand it back to you, Kristen, to walk us through Q&A.
Great. Thank you, Jen, and thank you everybody for sharing such a great overview. I do want to remind folks, please go ahead and submit any questions through the Q&A box. That's the best place for us to see them as chat gets busy here. I did see a few questions asking about accessing this recording of the webinar and the slides. So those resources will also be at that same website with the other resources. So please check that out. I do see a lot of great questions. I'm going to try to group some similar questions together as we kick off here. There's a couple of questions about budgets and timeline. One question is about the budget threshold. If organizations have operating budgets that are larger than $20 million, should they not apply, or is there any leeway with the operating budget total?
You want me to answer that? Yeah, so the, no, they're, other than, you know, perhaps being creative with partners, there is no, all applications have to have, come from organizations that have, a $20 million or under, annual operating budget. And this, again, just to reiterate, is to, emphasize the focus on, making these specific grant dollars available to smaller, grassroots organizations. Feel free to add, members of the team.
Great. Thank you for that clarity, Jen. Another budget-related question. Would program budgets be sufficient to meet eligibility requirements to apply, or are the total agency budgets absolutely required?
What's required, Anne Marie, do you want to answer that? Is this question, I'm just trying to be clear, is the question, do you
Yeah.
need to submit both budgets for the application?
I think it's that some folks might only have a program level budget kind of ready to submit rather than an agency-wide budget. And would that suffice for the budget requirement?
The budget requirement of what we ask for is that is how the grant money itself would be spent. So when we're looking at a budget for the project, so submitting a budget that reflects the amount of the grants, then we're looking for that submission to reflect the amount of grant money and where it would be spent. If the question is about whether the agency budget is more than 20 million, but the smaller organization or the department budget is less than 20 million, in that case, we are looking for the entirety. So if you're over 20 million in your, if the entire organization within which you sit is over 20, is 20 or over, then you're not eligible. The entire organization that you sit within and are applying from must be $20 million or under.
Thanks, Anne Marie.
I'm not sure which question, you know, but that the answers to both of those ways that you could interpret.
That's great. Thank you.
Happy
And
for clarification. Yeah.
yeah, if anybody wants to submit a follow-up question on any of these, you're welcome to do that in the Q&A section as well. Timeline question, if you could clarify if the 3 years are calendar years.
It's 36 months, but they start November 1st of 2025. So if they're not calendar years specifically, it's November 1, 2025 to October 31, 2028. Right.
Great. Thanks, Anne Marie. A couple of questions about use of the funds. Can these funds provide support to families impacted by any substance or specific to only opioids?
Opioid use disorder, opioids, and overdose need to be primary for the use of the settlement funds, because that's, you know, that's a requirement of the abatement findings. So we know that people are polysubstance users, and we know that not everyone is only, you know, uses one drug, but yes, overdose within the family or opiate use is primary to this grant.
Thank you, Jen. Is the goal to fund new or expanded program work, or will this grant fund existing work?
The grant can fund both. It can fund existing work as long as it's not supplanting, as we mentioned before, and supplanting any current Mass Health or BSAS DPH funding. But if it's in addition to, yes, these funds can be used for that.
I do see a few questions related to different aspects of partnership for the grant, so I'll try to go through some of those. Can organizations include their existing evaluation partners in their budget as well?
Do we need more information for that?
I
Um,
I think we would need a bit more information if they mean, could they put in their budget money that would flow then to their evaluation partner? I think we'd have to deal with that on a case by case, but we haven't done that before. I'll say that. But that may not be what is being asked in the question, so clarification would be good.
Okay, thank you. So again, welcome any follow-up questions or clarification if folks are hearing their question asked and need to submit more information. Can municipalities apply in partnership with a nonprofit, or can multiple nonprofits partner to apply for this opportunity?
yes. Yes, they can.
So either of those situations are welcome.
Yes, and we encourage people to sort of be creative on their partnerships, as we know. In a lot of communities, there might not be one primary family provider. So as long as it fits within the guidelines, yes, those are acceptable.
In terms of how that would work, we would ask that one organization be the lead applicant. And then in the proposal, be very clear that the partnerships exist, and perhaps that can be also shown in the budget. But just in terms of grant making purposes and application purposes, there would have to be one of those organizations that would be the lead applicant that we would, execute the agreement with, that kind of thing, just to be clear on
And I imagine a follow-up question on that might be, does that lead applicant have to be the 501c3?
I think we prefer that, yes.
Okay. Thank you. I see a couple questions asking if an organization is a current RIZE grantee, are they allowed to apply through this opportunity as well?
Yes.
Okay. Again, I would anticipate a follow-up question on that being, how about a current Mosaic grantee specifically, given that this is similar funding?
Right.
Overall.
Everyone is eligible. Nothing about being a current Mosaic or RIZE grantee would disqualify you from applying.
Great, thank you. Related to partnerships, if there is a partnership applying, does only the lead application or the lead applicant submit their audit, or do all partners need to submit an audit?
Just the lead applicant.
Just a lead applicant. Okay, great. This is jumping over to a program question. This question is, our evidence-based program, Parents in Recovery for Moms and Dads, is rather specific in its focus. Is there any role that RIZE could play in assisting with networking or connecting for opportunities with potential partners? And this is coming from a small nonprofit.
We can always help with connecting people to organizations. Our website, the Mosaic website, lists all of our current grantees and where they are. I think is the question that this organization is applying or looking to partner with someone who may be applying? If you could.
Yeah, I think it's not completely clear from the question if this would be a need for the application itself.
Looking to partner
John just said in the chat box is looking to partner. Yeah.
And I would say that once the grantee cohort, once the awards have been made, one of the things we do, which I think either Elizabeth or Anjali mentioned, we do bring the cohort of grantees together for networking and learning opportunities. So that is something, if you were to be awarded, that's baked in to participation in the Mosaic program, is that kind of networking and support.
Thank you. This is maybe a different angle of the question on partnerships. Is there a stress or maybe an emphasis on collaborating with other organizations rather than working in silos to provide the most wraparound support for individuals and families? So would that be a preference from the review standpoint?
Repeat the question.
Sure. Is there an
Yes.
emphasis on collaborating with other organizations rather than working in silos to provide the most wraparound support for individuals and families?
Well, I think it's always an advantage to be working together within the community, with your community partners, but there's no, currently there's no additional points or anything in the review process that would, you know, emphasize one over the other, I guess I would say, and other team members feel free to jump in.
I would say the goal is to really support that kind of wraparound that you're talking about, to multiple pathways and multiple supports. That can exist in one organization, or it can exist in in a partnership that's created. I think we're looking for what is the impact of the activity, that's the lens, rather than how many organizations are involved. But it can work both ways, I think. But our goal is yes, to not be siloed.
Great. Thank you. This is an evaluation question. It might be a good one for Ranjani. Would the evaluations require institutional review board approval for research, or would evaluations fall under quality improvement?
Thanks, Kristen. So I can't say 100% yet because it depends a little bit on some of the details, especially around whether or not we're collecting data that counts as identifiers, whether it gets defined as human subjects or not. I will say, based on my past experience with similar projects, is most likely would be determined not research, would be determined quality improvement oriented program evaluation. Sometimes we will ask the IRB to document that just so that we have it sort of like fully reviewed and they make a determination of not research. Either way, if we determine that it needs to go through an IRB, ICH as the researchers, we will handle that with our IRB. The grantees would be considered program partners and not research partners. Sometimes grantee organizations have their own IRB processes depending how you are situated, and we can definitely work with you on whatever documentation would be needed in that case. And the last thing I'll say, if any applicants are HIPAA covered or fall under 42 CFR, we can also establish, again, depending on whether we're collecting identifiers or not, which is to be determined, we can establish QSOAs or business associates agreements or whatever data sharing documents are necessary to make sure that we're all fully in compliance.
Thanks, Ranjani. I see a question about sustainability of the funding and what's being asked for under this grant program. Will what is being asked for as far as funding be sustainable past the 3 years, or will there be options for continued support past the 3 years? So maybe RIZE team, if you could just share maybe the expectation for sustainability of what applicants are proposing.
Right now, it's a 3-year grant program, but again, all of these grants are hopefully, providing developing best practice that we would hope we could work with you on sustainability, whether it's working with your organization or, sort of advocating. But at this point in time, these are 3-year grants, but we will be working with you on the development of this grant as a best practice and how we can look at sustainability. I think that we are doing that with all of our grantees now, so that we will work with folks on that. But this particular grant is for 3 years.
Thanks, Jen. Back to a question about the threshold for eligibility for fiscally sponsored programs. Are you looking at the fiscal sponsor's budget for the eligibility cap of 20 million or just a particular program applying?
We would be looking at the program, not the fiscal sponsor's budget.
Great. Thanks, Anne-Marie. Question about how funds can be used. Can funds be used for capacity building or hiring people with lived experience?
I think you can hire people with lived experience to provide a service for children and families, that would fit into the grant. So it would not preclude that, no.
How about the capacity building question?
I don't think there's a, that's not precluded either. I think it's, what we would want to know, what the program was for capacity building. Certainly there's a lot of room in communities to build capacity around working with families or around opiate overdose, harm reduction, other types of family support. So, I could see a program like that, that was specifically focused on building capacity within the community, and children and families. So yes.
Jen. I see one more question that I'll ask in just a moment, but do want to encourage folks, if you're sitting on any potential questions, go ahead and submit them. We have a good 7 or 8 minutes left that we'll keep answering questions if we have them. And actually, these 2 questions are now related. So a few moments ago, Anne-Marie shared that the preference is for the lead applicant to be the 501c3 nonprofit, but these questions are kind of related to that issue again. So I don't know if you'd like to add more to that, Anne-Marie. One question is, how strict is the requirement to be a nonprofit? And the other question is, if an organization operates as a nonprofit and has a proven history as such, but not designated as a 501c3. So I think maybe folks would just like to hear your thinking on that again around that preference versus, complete ineligibility.
Sure. So when I said preference, what I should have been clearer about was between a 501c3 and a municipality.
Okay.
Anything in terms of, so a 501, besides a municipality situation, we can only fund a nonprofit or a 501c3, which is why we are open to having fiscal sponsors. But any other kind of 501c4 or an LLC, those would not be eligible to receive funds.
Great. Thank you for clarifying that.
Sure.
I don't currently see any additional questions, but again, oops, here's one. Every time I say that, one pops in. Let's see. If we are an agency in an underserved, highly impacted community, but do not focus on opioid-related families, but all youth in our community, would we be eligible? So it sounds like the program is youth-focused, not specifically family-focused, and they're asking about eligibility.
If the service, if the program is addressing overdose, the impact of the opioid epidemic and such on families and or the youth, then yes, if like you can apply. I think that would be fine. Obviously the goal is supporting families that have been impacted, but that could include, a youth focused program.
Jen.
I think it's one of the categories as well. So you can look into the guidelines and feel free to submit additional questions to us at GrantsAt. if the guidelines doesn't sort of give you the parameters that you're looking for.
Thank you, Jen. Maybe while we just wait a moment and see if we get any final questions, we can also do a few of those additional reminders, like the one that you just offered, Jen, to please submit any and all questions to grants@rizema.org. I know the RIZE team has been incredible about responding to questions that come in. And of course, the materials from today's webinar will be posted on mosaic.rizema.org, including a Q&A that will include these and other questions that have come through. We also shared earlier in the webinar a link to register for office hours on May 19th at 10 a.m. That's an opportunity where you can just come with your questions, and we'll answer as best we can live there as well. And I wonder, from the RIZE team, any other final thoughts or reminders on your mind after hearing these questions today before we close out?
No, we look forward to hearing more. And again, yes, please ask the questions. This is a really exciting opportunity, I think, to get settlement dollars out to communities in a way that I don't think has been done yet. So we're really excited about this grant opportunity. Thank you for being on the webinar and for your interest this far.
Thanks, Jen. The last plug I'll offer is you should be receiving an email from the ICH team, our evaluation partner, with an evaluation link for this webinar. Please take a few moments and complete it. It helps us to provide as much support to applicants as possible for this grant funding. So we appreciate your input when you receive that. I don't see any more questions, and I see lots of people saying thanks and signing off. So I think we can probably close out, but again, welcome your questions at grants@rizema.org. And thank you all for your interest and taking the time to be here with us this afternoon. Have a wonderful afternoon.